Namaste. Welcome to the next lecture of Clinical Ayurved. Myself, Dr. Mayuresh Agte. I have discussed Amlapitta in detail and I have taken much more time to discuss all the shades of Amlapitta because in practice we see all types of such patients very frequently, and hence I have taken so much of episodes on Amlapitta. Now, in last lecture, we have discussed about the type of the Amlapitta or the Hetu which lead to the ulcers, peptic ulcer or gastric ulcer. Hence, in that connection, we will discuss the topic today is Parinam Shul. Now, in text, they have discussed that the stool which increases in the time period of the digestion, or when Anna is getting into the parinamana phase, digestive phase, at that time the stool, Udra stool increases. Many Vaidyas compare it with the ulcer, mainly peptic ulcer, because when food passes from stomach to intestines, at that time where the digestion process starts, the stool is aggravated. In last lecture of Amlapitta, I have discussed that Tishna Ushna Hetu Sevan leads to the erosion of mucosa, or there is destruction of internal mucosa of the digestive system, and ulcers are patients are very prone to form ulcers. So in that regards, I am taking this chapter today. Now, I will not go in detail whether Pranam Shul is equal to ulcer or not, but like Amlapitta, we come across the patients of gastric ulcers or peptic ulcers or ulcers in the intestines like ulcerative colitis very frequently. So let us discuss this today. Now, simply think, mainly always remember for ulcer, Tikshna Ushna Hetu, Madhya Sevan, Jagran, all Pitta Prakava Hetu are important. So in Chikitsa, Hetu Parivarjan is the must. Secondly, what you will think about the ulcer is the Vrana. So simply Vrana Ropan is the line of treatment. This is the second point. Third point, when the ulcers are there, the underneath blood vessels many times get open, and that's why person gets bleeding either through Urdhva Ratta Pitta or through the motion. So if there is any Ratta Strava or bleeding condition in the ulcer, Ratta Stamban will be the another line of treatment which is required. So this I have discussed in the last lecture. I think I am just making it revision. Now, ulcers, the treatment is Ropan. So which dosha will be taken consider of? Of course, Kapha dosh, because it is healing power. Then Mamsa Vruddhikar, because Mamsa is responsible to healing the wounds. Hence, the guna which are important in such cases are Madhur, Shita, Snigdha, Shlashna. I have discussed this in last lecture. I am focusing now on the new part of it. Now, patient is diagnosed as an ulcer, whether it is gastric ulcer or peptic ulcer or ulcerative colitis. The guna, Madhura, Shita, Snigdha. Shita will be for Stamban or Pratta Stamban. Shita is also, all these guna have healing properties, Shlashna also. So this is the second part we have chosen to the treatment. Dravya like Shatavari, Ashtimadhu, Sariva, which you will be good for the patient, you can decide on your own experience. What will be the Anupan in such patients? Now we have to heal the ulcers. Secondly, if there is any bleeding condition, you have to stop that bleeding. And as I said, pitta prakopa hetu are many a times hetu for the ulcer patients. So pitta shaman is another thing you should be in. It should be in our mind. Taking into the consideration for these patients, the best anupan for any dravya is Gruta, Pittashamak, Vadaropak, Raktastambhak. In my practice, I always use anupan Gruta for such patients. First thing, my experience is the medicines in the powder form have a mixture with the Gruta, and just letting it frequently will also help a lot to heal the ulcer. So generally, Yashtimadu as a ekeri dravya, Sariva as a ekeri dravya, or mixture of two, no problem. Ekeri dravya also has a great results in the types of ulcer with Anupan Gruta. Now, second question, second thought is, at what time it should be given? Now you have to think. We are now doing the ropan thing. So we have to increase the kapha firstly, or dhatu vardhan is to be done, and hence the Aushadha Sevan Kal which I prefer in this patient is Ananda Kal or even Rasayan Kal, because in the Ananda Kal or Rasayan Kal stomach is empty, there is no food, so the medicine you are giving will occupy all the internal organ and will have its specific action very fast. So in my practice, I ask the patient to use Anupan Gruta. Secondly, give that empty stomach either early morning or before lunch and dinner, enough time before lunch and dinner when there is no any food inside. These two things help to heal the ulcer, also stop the bleeding very miraculously. When the patient is suffering from ulcerative colitis, which is in the intestines, then in that case the Aushadha Sevana Marga, which is the nearest one, is of course Basti, and so Basti of the Dravya Snigdha Pichila Guna like Mocharas is also effective. In my practice, I have treated the patients with such line of treatment, and the patient who were suggested operative for the ulcerative conditions, the surgery is being prevented and patient are fit and fine with the Shamana Chikitsa or even Basti Chikitsa in case of ulcerative colitis like condition. So any ulcer in the GI tract or in the body inside, you will find that Madhur Shita Snigdha Shlashna Dravya, Anupan Gruta and Aushadha Sevan Kal, Ananda Kal helps a lot. This is my experience. I will like your experience also to share with me. Next time we will come with another new topic. Thank you very much.